Hi, I'm Harris Harrington, creator of Depersonalization Recovery Total Integration Method, a complete 10-hour recovery course for sufferers of depersonalization disorder. Today, I want to talk about medications and depersonalization disorder. So a lot of people that acquire depersonalization disorder use medications and sometimes in conjunction with therapy, in particular cognitive behavioral therapy. So since this is a very common treatment, it begs the question whether or not medications are useful or effective at treating or curing depersonalization disorder. Now, some people get a benefit from medications, but most of the time, the vast majority of the time, medications worsen and prolong depersonalization disorder. Okay, so they don't even help, they make it worse. And there is no known cure for depersonalization using medications or any pill. So basically, medications are not effective at treating depersonalization. So why are medications so ineffective at treating depersonalization disorder? In order to answer that question, you have to understand what causes depersonalization disorder. So depersonalization disorder is caused by accumulated trauma that builds up in a person's mind. It reaches a point where it becomes too painful, there's too much psychic pain, and a person splits off from the pain, dissociates as a way of sort of getting away from the pain and gaining psychological safety. So this trauma comes from emotional abuse in childhood, parental neglect, social isolation. It comes from dysfunctional family systems, being part of a dysfunctional family system and having psychological abuse. Depersonalization is caused by traumatic events. It's caused by interpersonal trauma with other people, stressful relationships, and it can be triggered in a number of ways by marijuana, hallucinogenic drugs, a panic attack. It can come about gradually, but basically, you have to deal with these underlying emotional psychological issues in order to overcome depersonalization disorder. Likewise, you have to overcome the obsessive component as well. That's important, and there's cognitive principles for that. But more importantly, it's the emotional abuse and the unresolved trauma that needs to be resolved and dealt with in a conscious way. So medications prolong depersonalization because they often deter people from facing their emotional issues and developing emotional resilience and psychological growth. So what happens is they take a medication and it numbs the pain, and they don't look at what's causing the pain. They just sort of ignore it, and the medication allows them to go on and not really grow or improve, and the disorder remains. Other times people take medications and it just makes symptoms worse, and it makes everything worse, and it's a total fiasco. Okay, so there's a lot of people that take medications have that problem because a lot of medications are addictive, or they ironically cause the symptoms of the disorder they say they treat. So there's withdrawal symptoms from medications. There's lots of bad things that can happen when you take a medication. But even if a medication's, works, quote unquote, it often just helps a person keep the disorder, but become numb enough or, sort of can dissociate from the pain enough to go on and not really grow. So it's important to really face your trauma and integrate that. People with depersonalization have a wounded sense of self, and it comes from having a stigmatized part of yourself that you have pushed out of conscious awareness. You have to bring these things into conscious awareness and just become aware of them and then process them and integrate them into who you are. And I talk about that at length in my program. And this is the reason why medications deter, prolong, and worsen depersonalization. And so to overcome and completely get rid of depersonalization, you've got to look at the underlying causes and get rid of them. And that's how you totally recover.